I want you to imagine that you are this young Aboriginal boy. You live with your mum and dad, aunties, uncles and cousins, all in the same house, and all of them smoke. But hey, that's okay, because everybody in your community smokes. It's normal. And after all, you don't want to be different to everybody else, do you? This is the picture of 1 in 2 Aboriginal children living in Australia today. But considering what we know about the health effects of tobacco use, why is this still happening? And that question is what I hope to address as part of my PhD. I've reviewed all of the publications reporting on the effectiveness of culturally tailored tobacco prevention programs for Indigenous youth. And though we all know this is an important health issue, I found only 6 studies that have ever been conducted in the whole world, and not even one of them was done here in Australia. But perhaps even more disturbing was that in 2 of these studies, more kids ended up smoking in the tobacco prevention group compared to those kids who got nothing at all. If we now consider that $1.6 billion has been invested by the Australian government to close the gap in Indigenous life expectancy, with a lot of money invested into tobacco prevention, it is very surprising that we were unable to identify any Australian studies so that we actually know if these programs are even working. Because if you were investing $1.6 billion, wouldn't you want to know? Though some people may say, well, any intervention has got to be doing some good. We now know from our review that that's not the case. In fact, we could be doing more harm by continuing to run these programs without any good quality evaluation that runs alongside them. But in order to really understand why up to 50% of Aboriginal people continue to smoke, compared to just 17% for non-Aboriginal Australians, I will be conducting focus groups and interviews with Aboriginal smokers, ex and non-smokers. But research in Indigenous communities isn't easy, and many Aboriginal people have a real distrust of us whitefellas. And I can tell you, much to my dismay, that my legs are as white as they come. For that reason, it's really important to have the backing of community organisations that are important to Aboriginal people. And after all, what's more important to us Aussies than AFL footy? On a few occasions now, I've had the pleasure of going to the Port Adelaide Football Club, and I can guarantee you, it really was my pleasure. And I met with a few of the players who are just as keen to improve the health of Aboriginal people as I am. For that reason, they are now evaluating campaigns of their own, such as this one with Daniel Pearce. Only through combining all of these pictures together can we really hope to make a difference and give Aboriginal kids in Australia the best possible chance of a long and healthy life by being smoke-free.